in the meantime, can you tell me about how you prevent all the complications that might occur? So since we know that you treat a lot of patients, celebrities, and all the like business high rolling clients, how would you, what is your strategy to prevent complications that might occur?
So this is very important. First, you have to learn and to know anatomy by heart. Where are the danger zone? Where is the facial artery? Where is the angular artery? So we organize courses about that. This is very important to know where to inject. The second point is always inject small amount of product to each point of injection. Look at the skin. Be careful with when someone has a sorry, I'm crossing the road. Sorry.
Yeah, I know. It's like you're walking and talking, and it seems like you are taking us a tour in Geneva. So I can see all like, you know, the background behind you.
Yeah, and I'm going to my car now. I'll stop. I just sit down. Voila, was a bit noisy, sorry. So yeah, the other concept is to look at the skin. If the skin is coming white, blanching, you stop. And also always to have hyaluronidase in your office. And don't hesitate. If something goes wrong, like blanching and the severe pain, I stop and I inject immediately hyaluronidase. And also what is important to avoid the vascular complication, not only artery, but the veins, I ask the patient, if I do a nose injection, I ask for a picture at night, the day after, the night after, and I follow by phone, by WhatsApp, and pictures for 2 days. Because it happens to me, a terrible story, who end up with a good result. But I was last summer on vacation, and I injected a nose. And thanks God, a friend of mine who is here, Dr. Schlaudraff, a plastic surgeon from Geneva, so he saved the nose by injecting some hyaluronidase. And I was far away, I couldn't come back. And thanks to him, so the lady sent me the pictures, so he injected some hyaluronidase and saved the nose. So this is very important for the following, and the lady end up with no scar, nothing.
Oh, great. And then you, is this the worst complication that you face in your career?
So, you know, when I was a surgeon, you face a lot of complications. That's how we learn.
I see. What is the worst one?
So the worst one, at the beginning of my career as an injector, I injected. It's the worst because the lady was great. She was famous in Monaco, and I injected her with some toxin on the lips. And she developed herpes, and then from this herpes, terrible herpes, she developed some paralysis of the face because the toxin diffused because of the swelling, so from that time, I always ask, do you have herpes disease? And of course, I inject just a few on the lips, but was terrible. Of course, well, I never had necrosis, thanks God. But I saw some necrosis, and I saved on live in Azerbaijan. Some of maybe the doctor are online. I was doing a course for fillers. I was doing my sculpture and this cheek lift, etc. And then at the end of the session, I removed my gloves, and the lady came and said, "Doctor, can you treat my patient? She had a terrible infection here." It was not infection; it was a vein compression, and the nose and all the mid face was going away. And on live, I injected 2 cc of hyaluronidase, and I saved this face. So that's a terrible story. Wow. Who ended up on the grade, and that was on live. And they said, "Yeah, do it on live." I said, "No, I cut them the video on the camera." No, we want to see what you do. And I injected 2 cc, and then the other day, which is 3,000 units of hyaluronidase, and the other day I re-injected her. And I want to thank my colleague from Ukraine, Dr. Al-Nagash, because she's the one who followed the patient. She was not responsible, but it was a doctor from Baku who did the injection. But Dr. Al Nagash was really great and followed the patient and treat her also.
All right. For the complication from hyaluronic acid fillers, do you have protocol for using hyaluronidase on that? Do you go like, 300 units and then follow up how many hours afterwards? How often you repeat injecting?
So if it's artery, I mean ischemia, I use immediately more than 300. I use 500. I wait and I re-inject 500 if it's necessary immediately. And I keep the patient in my office for 1, 2, 3 hours up to the end of this ischemia. And I think ischemia is easier to correct than the other complication, which is the compression or the thrombosis of a vein, which starts the day after with a little bit of purple, a little bit of redness, and then pustule, and people say, oh, I have an infection, can I take some antibiotic? And then we lose days and days. So when they have this second kind of complication, the protocol is, of course, they come back immediately, even on Sunday, even at night. I inject, after a good disinfection, I inject, let's say, 500 units of hyaluronidase, and I inject all around, not only where you see the problem, but all around. And because of the diffusion of the hyaluronidase, you can save a lot of cases.